Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology and gastroenterology. Our topic today about syphilis tips. So we will discuss how to prevent syphilis. The best way to prevent syphilis is to practice safe sex. Use condoms during any type of sexual contact. In addition, it may be helpful to use dental dam, a square piece of latex, or condoms during oral sex. Avoid sharing sex toys. Get screened for sex transmitted infections and talk with your partners about their results. Syphilis can also be transmitted through shared needles. If using injected drugs, complication associated with syphilis. So, untreated syphilis can have devastating effects, including gammas, which contain masses of dead, swollen, fiber-like tissue. They are most often found in the liver. They can also be occur in the brain, heart, skin, bones, eyes, and testes. This may lead to blindness, hearing loss, brain damage, paralysis, meningitis. Also may lead to heart valve damage, aneurysm. Also can lead to aortitis. This means inflammatory aortic disease. Also can lead to HIV. People with syphilis have a significantly increased chance of contracting HIV. The source of the disease causes make it easier for HIV to enter the body. It is also important to note that those with HIV may experience different syphilis symptoms than those who do not have HIV. If you have HIV, talk with your doctor about how to recognize syphilis symptoms. When should I test for syphilis? The first stage of syphilis can easily go undetected. The symptoms in the second stage are also common symptoms of other illness. This means that if any of the following applies to you, consider getting tested for syphilis. It does not matter if you have ever had any symptoms. Get tested if you have had unprotected sex with someone who might have had syphilis. If you are pregnant, also if you are a sex worker, if you are in prison, if you have had condomless sex with multiple people, if you have partner who has had condomless sex with multiple people, you are a man who has sex with a man, you have to test yourself. If the test comes back positive, it is important to complete the full treatment. Make sure to finish the full course of antibiotics, even symptoms disappear. Also, avoid all sexual activity until your doctor tells you that it is safe. Consider getting tested for HIV as well. People who have tested positive for syphilis should notify all of their recent sexual partners so they can also get tested and receive treatment. When to talk with a doctor? If you believe there is a chance you have been in contact with syphilis, visit the doctor. The signs and the symptoms of syphilis may be difficult or impossible to detect without a blood test. Talk with the doctor if you notice what you think could be syphilis source. Have been told by a sexual partner that they have syphilis. Are sexually active but have never had an sexual transmitted tested, infection tested. Also be aware that all pregnant people should receive syphilis test in their prenatal appointments as a part of standard care. If it does not, like, this test will be included in your initial prenatal blood panel, ask for it. Frequently asked questions: is syphilis 100% curable? Yes. Syphilis can be cured by taking the antibiotics your doctor administers. However, any damage that has already been done by this disease cannot be undone by taking antibiotics. What are the signs of syphilis in a person with a penis? The early symptoms of syphilis often go overlooked. A syphilis sore called a chancre usually occurs where the infection enters the body. This can be the penis, scrotum, anus, or mouth. The sores is usually painless and resolves on its own. As the disease progresses, rashes will occur on the parts of the body, including the palms of the hands and the soles of the feet. How long can you have syphilis without knowing it? Untreated syphilis progress into the latency hidden stage. After the second stage, rashes resolves. During this stage, you will have no symptoms. Latency can last anywhere from 1 to 20 years or longer. If you suspect you may have contracted syphilis years ago, see your doctor for a blood test. You can still have treatment that cures the disease and stops future damage from occurring. Will I always test positive for syphilis? You may. The antibodies produced by syphilis may stay in your body even after treatment has occurred. This means that you may always test positive for this disease even you no longer have the bacteria. Can syphilis be cured? Yes, syphilis can be cured. The bacteria infection can be resolved by undergoing a full treatment regime of prescription antibiotics. Any damage done to your body organs cannot be reversed by treatment, but further damage will be prevented. Sexual transmission of Treponema pallidum is thought to occur only when mucocutaneous syphilitic lesions are present. Such manifestations are uncommon after the first year of infection. Person exposed through sexual contact with a person who has primary, secondary, or early latent syphilis should be evaluated clinically and serologically and treated according to the doctor recommendation. Thank you very much. We can observe that a diagnosis of primary, secondary, or early latent syphilis before 90 days before diagnosis should be treated presumptively for early syphilis. Thank you very much.